This week, we will be discussing the health risks and common problems that are stirring up in Pakistan. These health issues range from common health problems, vaccination, mental health, and access to health care. To start off, we are going to talk about the common health problems. Pakistan has a population of 180 million. It has more child, fetal, and maternal deaths than all but 2 other nations. That makes it the third highest death rate for these categories. These health issues include unsafe abortions, lack of nutrition, malaria, and diarrhea, all which we beat out the common health problems of other nations like heart disease and diabetes. 40% of children are underweight. Next, we move on to what vaccination in children is like. There is an avoidably high child mortality rate. As we said before, 40% of all children are underweight. Vaccinations only come from out-of-country donors that help vaccinate kids against diseases that otherwise they would not be protected from. This is a very interesting issue because the government of Pakistan doesn't make it a priority for vaccinations, but other countries make it a priority to help Pakistan with their vaccination. In 2019 alone, an unsafe strand of polio vaccination was put 25,000 children in the hospital. Children are not often vaccinated at birth. This makes for the high mortality rate and an increase of diseases that could otherwise be avoided. This also means that eradicated diseases are more prevalent in Pakistan because they have not been vaccinated against. The next category we're going to talk about is mental health. Mental health is the most neglected health field in Pakistan. It is said that 10 to 16% of the population suffer. That means that there's 14 million people suffering from mild to moderate psychiatric illness. The majority of them are women. Pakistan only has 1 psychiatrist for every 10,000 people suffering with any of these mental disorders. And including, there's only 1 child psychologist for every 4 million children who are also estimated to be suffering from these same mental health issues. The prevalence of mental disorders in Pakistan is tremendously increasing in the background of growing insecurity. There's just so much poverty, violence, terrorism, economic problems, political uncertainty, unemployment, stressful working conditions, gender discrimination, unhealthy lifestyles, and other genetic factors that just put some people over the edge. And then with not enough doctors, many people just live their lives while suffering. The last issue is that healthcare in Pakistan is the most corrupt sector. Pakistan has no national health insurance, making it very, very expensive. It is really needed within all the people due to the poverty and the conditions of living, but it's just too expensive for these people to get. There's low public spending in healthcare because of the lack of ability to get it and then pay for it. Therefore, their healthcare can never grow because there's no money going into it. And there's a very high rapid population growth that only makes resources that are spent on healthcare even smaller results because there's more people and still which makes it even less available to other people. All these health issues are major problems that Pakistan deals with every day. Unfortunately, we can't just go in and fix them all, but it is something that we should all be aware of in order to help do the best that we can. I want to say thank you to so much for everyone's support and their listening on what it's like for health issues in Pakistan. Tune in next week for another Spotlight Country for the World Health Issue Podcast.